Well, let's go to the Minister for Health, Greg Hunt, now, joining us live. Minister, good to see you. Thanks for your time this morning. So you've got 300,000 of these COVID pills, molnupiravir, on order. Given the lessons of the past, have you ordered enough?
Yes, that's the advice that we have from Professor Brendan Murphy and what's called the Scientific and Technical Advisory Group. And what does this medicine do? It's a monoclonal antibody. It basically helps the body's immune system fight back against COVID. It reduces the rate of hospitalisation and death on the clinical trials to date by approximately 50%. So it doesn't eliminate it. It's absolutely essential that we're vaccinated, but it works with vaccination to save lives and protect lives.
So it's basically a pill that you'd probably have in the cupboard, like Panadol.
Well, correct. It's one which would be prescribed for somebody in the early stages of COVID. Generally at this stage on the clinical trials, it's the first 5 days. And it's a very important additional part of the treatment. We already have 2 medicines, remdesivir and Sotrovimab. They have to be administered in hospital, but the big difference here, exactly as you say, Pete, is it is a pill, and importantly that gives particularly strong options for people who are not near hospital. And all of these elements mean it brings us closer to opening up safely and giving people the option to be able to protect themselves. And these things, vaccines first, but treatments alongside it will help to save lives.
OK, well, on the issue of time, Merck, the company, hopes, whether it happens or not is a different matter, but it hopes to have it cleared for emergency use in the United States within 2 weeks. So would you be hoping that the Therapeutic Goods Administration expedites its approval here?
So it will have priority approval process and status, and our goal is for them to submit at the earliest possible time. I've spoken with the CEO of the Australian arm of MSD, or Merck Sharp and Dohme, to encourage them to do this at the earliest possible time. And at this stage, we're expecting that they'll make that application, and we are looking to be able to have this available in the first quarter of next year on current international supply and contract and approvals timelines. OK,
now given our very high vaccination rates across the nation at the moment, Minister, when do you see Australians having a third booster shot?
So that's now currently being assessed. We've purchased more than enough vaccine for booster shots, and we are ready to do that either early next year or for select groups if the medical advice were late this year to do that. So we just continue the program. And so we're in that position. It's now a medical question which is being assessed by the Australian Technical Advisory Group on immunisation. And we have 60 million Pfizer available for next year, 15 million Moderna and 51 million Novavax, which is the protein vaccine, still going through its late-stage trials, and it hasn't applied around the world, but it's had very, very promising results. So we have many options available to protect Australians. All of these things together, exactly as you say, they work, vaccines, boosters, treatments to provide that additional coverage.
Just with an eye on New South Wales government, New South Wales politics, which is in a bit of chaos at the moment, Minister, the timing isn't great, as you would admit, surely, given the crucial phase of the pandemic at the moment. Do you have any concerns about a smooth transition?
No, I'm very confident that there will be a smooth transition. The government has its direction, which has been set collectively and with deep, broad support from all my understanding. They are now over 88% with first doses in New South Wales, and that vaccination program's continuing apace rapidly with a real focus on speed and breadth of coverage. That's leading to an opening program, and you can see the dropping of the cases. Now, we're not out of the woods anywhere yet. We all have to assume that over the course of the next year, every Australian at some stage will be exposed to COVID or in a COVID situation, which is why we want to continue the vaccination but we have to be able to vaccinate, support the care of patients, and at the same time open up and give people the chance to see their loved ones, to live their lives, to return to work. All of these things are just so fundamental. We're in the lowest 3 countries across the entire OECD for lives lost through the pandemic and this year, and we want to continue to maintain that, but at the same time open up. So it's a mighty national task, but Australians have been stepping forward. But if you haven't been vaccinated, please come forward. This is your chance.
Just on that, you might be aware that England's cricketers may not want to come here now because of our quarantining situation. Can there be any special quarantine requirements that are given to the English cricketers to make sure the Ashes can go ahead?
Well, I really hope, both as a minister but as a deep cricket fan, that they do come. I've been in contact with Richard Colbeck throughout the recent weeks, our sports minister. He's been working with his UK counterpart. The Prime Minister's been working with Boris Johnson. And we are hopeful that we will be able to have this go ahead. Ultimately, it's always in the hands of the touring party. But we've been working to be flexible and practical. On the one hand, make sure that we have safety arrangements for Australia. On the other hand, to be practical and flexible, to give that touring party every chance of coming here and to have the Ashes played this summer.
OK, Minister, appreciate your time. Thanks for joining us.
Thanks, Pete.